Dr. Doug Holmes. I'm an ear, nose, and throat surgeon. This video is being created to inform you about sinus disease, about what I can do to help your sinuses and your sinus condition, and hopefully dispel some myths about sinus surgery that was problems that was present years ago with sinus intervention, and to highlight for you a very exciting advancement that we have in making surgical treatment of your sinus disease so much easier and so much better. Now, your sinuses are located in your face. Everyone knows where there's sinuses when you get an infection, you get a lot of pain over your face, like someone has a claw over your face. We have several different sinuses that we deal with. We have the cheek sinuses, which are called the maxillary sinuses. Those are the ones where you'll get pain in your teeth when you have an infection. Sinuses between your eyes, called your ethmoid sinuses. Your forehead sinuses, your frontals. And then way deep in the middle of your skull, your sphenoid sinus, which can give you symptoms of pain and discomfort in many areas of your head. What are the sinuses there for? We're actually not really sure. We do have some theories. Is they act as some packaging for your brain, in that if you had some sort of trauma to your face, they would absorb some of the energy before it was transmitted to the more important aspects of your brain. They help to filter the air that you breathe, supply humidity to the air, and they also make our heads weigh less, because instead of having solid bone, we have air, and perhaps this developed along the developmental lines when we started walking upright with without as much force you need to hold your head upright. Signs and symptoms of a sinus infection and chronic sinus disease. If you're watching this video, you probably know exactly what they're all about. It's pain and pressure over your forehead or between your eyes, different types of headaches, and along with these infections, they make you tired and fatigued. Many people will have a continuous problem with this, and some will have recurrent infections where you clear up in between. Besides a physical exam, the best way for us to diagnose a problem with your sinuses is with a CT scan. It's the diagnostic gold standard for looking at your sinuses. And we also use it preoperatively to make sure that there are any areas of obstruction of your sinuses, things that are leading to your sinus disease will certainly be addressed. And what we look for in the sinus CT is an area where there's thickening of the lining membrane, or actually a collection of pus and fluid within the sinuses. So for a review here of the anatomy, this is a picture taken like you're looking at yourself. It's called a coronal view. So if you were to take a picture of yourself and look at yourself, but then do certain slices through there, this is what we have. So the eyes are here. So this is this patient's right eye, and this is this left eye. This is the nasal septum that separates left from right. As you can see, there's a little bit of a bony spur on this side. These are your turbinates. Your turbinates come in from the side of your nose and supply a greater surface area to warm and filter the air better. Sometimes these turbinates get so big that you can't breathe well. They get big with allergies, and this is the medicine that is treated with decongestants and with nasal steroid sprays. These are the middle turbinates. Then off to the side here we have the sinuses. Here we have the front part of the cheek or maxillary sinuses, part of the ethmoids here, and in this particular slide, the frontal sinuses and the sphenoid are not imaged. So a normal scan would have this scan that we just saw, a little bit more field of view. We have nice air within the maxillary sinuses, turbinates, ethmoids, which are like little honeycomb of air cells. Totally normal on that scan. As you go further back, then you pick up the sphenoid sinus right in the middle of the head. So what causes someone to get chronic sinusitis? The openings from our sinuses into our nose are very small. So any kind of inflammation or swelling from allergies or other problems can certainly cause a sinus infection. And then the other vast area of which we don't really know why some people get sinus infections, because not everyone who has allergy gets sinus infections. And we know a lot of people who have sinus infections who don't have allergies. So we just don't know. But we know that there may be an anatomic situation where the septum is deflected into the area that blocks up the sinuses. Some of the structures of the turbinates can do so. And the development of the sinuses is such that there can be some sinus cells, air cells that block the outflow of other air cells behind them, predisposing to infection. So sinus surgery started out with a somewhat barbaric approach, and that was where everything was opened up. There are no scopes used. This was akin to taking out your gallbladder, where you made a 12-inch incision here in your stomach, and now everything is done laparoscopically with scopes. And we've taken the same technology using scopes in the nose to find the area where the sinuses are blocked and to open them up. So naturally, this previous approach, which was in vogue about 20, 25 years ago, that led to a lot of postoperative symptoms. So this is the one that if you talk to someone who had sinus surgery 20 years ago is going to tell you how terrible it is. Well, it was pretty terrible, but that doesn't exist now. It's much better. So that's one myth that I want to break. We've taken this yet a step further into using balloons in the sinuses. So now instead of needing to go up and crunch through a lot of bone and remove a lot of tissue, now we have an opportunity of simply slipping a catheter into the sinus, dilating the balloon and opening the sinuses that way and fixing things. So this is a similar technology to cardiac surgery, where one goes in to revascularize to get better blood supply to the heart, open up a narrowed area, either put in a bypass graft, which of course involves open surgery, or what's called a angioplasty, where a balloon is put in and the vessel is opened up. So we've taken that technology from angioplasty into the sinuses, and it's even less of a problem of postoperative recovery. Also, using these techniques, there's a lot less need for persistent packing in the nose. So I've talked to people who have had sinus and nose procedures in the past. The worst aspect is the next day taking the packing out. Well, now, all this surgery can be done on an outpatient basis. So you go home the same day as your procedure, and your packing is removed in the recovery room before you go home. So there's no need for that next day packing removal, which was very uncomfortable. In a CT scan with patients with chronic sinusitis, you'll generally see some sort of blockage of the openings, and occasionally you'll see people who have a long history of sinus disease, yet that day the sinuses will be normal and be clear. You'll have to remember that a scan is just a single image at a single time and doesn't take up a whole year or two of experience. So the options for treating are using medical options that before you see me, your doctor has probably used for you. Decongestants, allergy medications and evaluations, nasal washes, antibiotics when infections occur, antihistamines or nasal steroid sprays. And if someone hasn't used those, then we try medical management first to try and control your sinus condition before thinking that we need to go to the operating room. But if medical management fails, then opening the sinuses will be necessary to relieve one of their condition. You'll especially know that you've had problems if you happen to be an F-15 pilot, because you're going through significant pressure changes when you fly. Barotrauma, baro meaning pressure, pressure trauma, pressure sinusitis is a terrible thing to have when you're sitting in a commercial airliner and you're starting on descent and you start to feel that pain and pressure in your sinus on descent. And many times it's just a terrible, debilitating pain that you can hardly stand until you get on the ground. And it doesn't necessarily go away just when you get on the ground. You can get bleeding into the sinuses or other problems. I've had the honor to fix two pilots, one a reserve tanker pilot and one an active duty F-15 pilot with their sinus problems and sinus blocks when they would fly. And so they're back flying again, defending the country. So for the balloons, as I described, it's angioplasty for the sinuses, in which we make a permanent opening into the sinuses, an opening that uses the natural opening but makes it much wider, and therefore the body doesn't act to reseal that opening. So therefore it addresses the cause of the problem, a very narrow opening. We're not making an end run around the problem. We're actually fixing exactly what the problem is. We dilate that area, breaking down any kind of bone and thin bone around it to make a permanent opening. A lot of times in the operating room under general anesthesia, it can be done under sedation, where the patient is awake but sedated. The nose is decongested, local anesthetic is put in as necessary. I look with a scope into the nose and determine exactly where the opening to the sinus is. When I've determined that, a little guide wire, and we'll give you an illustration here in a little bit, a guide wire is placed into the sinus. The position is confirmed by turning the lights down in the room. You can see the little lighted guide wire either in the forehead or the cheek sinuses. A balloon catheter is placed over that wire that straddles the opening. The balloon is blown up and everything is pulled back, and where there was once a small little opening, it's now much bigger. So, here's a schematic of a frontal sinus where this guide wire has been placed into the sinus. We would have turned the lights down and seen a light over the forehead. This is what it really looks like in the operating room endoscopically when I'm looking with a scope. And if you were to take an x-ray at that time, you'd see the wire going up into the sinus. Then the balloon is placed, which is fed over that wire already, is pushed into place. So it's in the gap here between, spanning the gap between the sinus and the nose through the very narrow opening. Here the balloon goes up. It's then inflated very gently under controlled pressure to reopen that opening, make it much bigger. And so as before, where there was stuff in the sinus, mucus, whatever, that couldn't drain out, now if the opening is big, it can drain out. And that literally does happen in the operating room. In post-operative, really, you can see where there's a small opening or not much at all, anything is much bigger. The sinus on the scan is nice and clear. So a little video for you of where of a procedure in a maxillary sinus. This is the patient's left sinus here. The wire has been placed around, the balloon is in, and the balloon is being dilated here, as you can see, to open up that maxillary sinus. So you can see from this there's going to be very little trauma to the surrounding tissues, and therefore the patient's recovery is going to be virtually pain-free. So this was a video presentation for you to learn more about your sinus disease and sinus condition and how I can help you as an ear, nose, and throat surgeon with a special interest and expertise in balloon sinuplasty. Thank you.